Healthcare and how to pay for it is really dominating the headlines again.
You know, a lot of parents are uncertain about what their health care is going to look like in the coming months, and the role of Medicaid is one of the most debated topics here. So our mid-morning pediatrician, Dr. Gigi Chawla, has brought public policy director Kelly Wolfe from Children's Minnesota, both here to give us some insight. Thanks for coming in, guys.
Thank you.
Thanks for having us.
Kelly, let's start with you. Could you tell us exactly, if you're not on Medicaid, you don't know what it is, maybe.
Right.
What is it?
Absolutely. So Medicaid is a jointly funded state and federal health insurance program for adults and children with limited income. It's actually the single largest insurer of children. Nationally, about 30 million children are on Medicaid.
Wow.
In Minnesota last year, there were over 600,000 children on Medicaid.
On Medicaid.
So it really is a lifeline for many of our kids. And in fact, it often acts as a safety net as well. So even if you have commercial insurance, Medicaid can pay as a secondary payer for those children who have low birth weight or disability. So you can qualify based on your income, but also disability status.
Dr. Gigi, I'm sure that you see this when you're working with patients one-on-one. What exactly do you see Medicaid covering?
You know, Medicaid is wonderful because it really has, at this point, been covering all preventative type of care. So primary care in clinics.
Those kind of well care visits.
Exactly, all well care visits,
special
specialty visits, acute care visits, and then hospitalizations and ER visits. So it's really an important safety net for our patients.
So based just on the numbers that you just shared, Kelly, we get a sense that any change in Medicaid would affect so many children. What are some of the impacts that you're looking at?
Yeah, no, exactly right. Because children do make up about half of all Medicaid enrollees, any changes to Medicaid financing, capping the funding could have significant impacts on kids. Right now, children have the lowest uninsured rate that they ever have had in history. We're at about 5% uninsured rate for kids. While we would like to see that be zero, we know that we've made tremendous progress. And so any potential cuts to the Medicaid program could put that number in jeopardy and result in kids losing access to health care.
How do people qualify for Medicaid? Is it a difficult process to go through?
No, your county, your hospital, if you are at the hospital, we could certainly help with that. It is state funded and federal funded, but the Department of Human Services could also help you enroll or get qualified.
Dr. Gigi, obviously there's a great concern if you have a growing number of young people showing up who don't have insurance because they are going to be treated one way or the other, right?
Right. I mean, we certainly want to do everything we can preventatively to make sure that kids are getting the health care that they need so that they're not seeking care on an urgent basis for more complex problems.
Sure.
And so that is, you know, really a primary focus.
The costs end up just being distributed to everybody else who can pay, right? So one way or another, somebody's paying for it.
Exactly.
All right, thank you both. It's good to know. I think a lot of people think of Medicaid as affecting senior citizens. So knowing that it affects so many kids is really useful.
Children.
Thanks, guys.
Thank you.